Hi, my name is Karen Boyle. I'm the nurse manager for general radiology in Johns Hopkins Imaging Nursing. I want to talk to you today about some concerns you might have about coronavirus. I know that you're concerned about the virus. I'm concerned about it too. And I want you to know that there are steps you can take to protect yourself from the virus. First of all, I want you to know that when you're screening patients, if a patient's in front of you coughing or sneezing, hand them a mask. In between patients, I want you to be wiping down your surfaces and I want you to be washing your hands or using hand sanitizer. Let me tell you a little bit of something about the coronavirus. It's spread through droplets, which means that when a patient coughs or sneezes in front of you, they're spreading those droplets into the air and then they fall down to the surfaces. So unless a patient is sneezing on you or coughing on you, you shouldn't have much to be concerned about as long as you're wiping down your surfaces, because those droplets go from coughing and they fall right down to the surfaces. So they're falling onto doorknobs, onto your desk, onto any surface that a patient can touch. So your best protection from coronavirus is to be wiping down surfaces and to be washing your hands and using hand sanitizer. Something else I can tell you is that when you're out in the public, you need to be washing your hands and using hand sanitizers because we're touching surfaces all day, every day. When you touch a doorknob, when you push the button for the elevator, when you're pushing the cart at the grocery store, you're at risk for catching any type of virus, including coronavirus. So what I want you to do to protect yourself is practice good hand hygiene, meaning wash your hands as much as possible and use hand sanitizer like the Purell we have in the office. I also think it's important for you to remember that between every patient, you wipe down surfaces, you wipe down your pens, your desk, your computer screen, your phones. Do whatever you can, wipe down anything that you think might come in contact with anybody's cough or sneeze or what they're touching with their hands, because most people cough into their hands. And what I can tell you, if you're outside and you're coughing, cough into your elbow or cough into a tissue and throw the tissue away and immediately use hand sanitizer or wash your hands. These are things that we can do all day, every day to protect ourselves from viruses, including the coronavirus, because we want you to be safe and we want you to feel comfortable. And I also want you to know that if you have any questions, you can feel free to reach out to your site manager or to any of the nurses at the imaging sites. I know they're happy to talk to you and help you get through your concerns and your worries. Thanks.